and Mr. Chris Fennell.
Yes.
In the back.
In the back.
They back him in here for some reason.
Yes, we did.
Yeah.
Yes, my name is Angela Lowry. My name and my email address is up there, and this is Bryce. And if I am not mistaken, today is about advocacy. Is
And
that
parents' role in advocacy.
Parents'
yes.
role in advocacy.
Mhm.
So in the past, I've kind of given you a lot of background on Bryce, and I'm gonna try to shorten that up and give you more time with Bryce. So as we're talking, please be thinking of questions, because he is excited and ready to answer them for you. So, Bryce is 13, he turned 13 on August 18th. He was born in 2003, and healthy baby. I'll just give you a little background. And I've shown pictures before, but he was super accelerated from birth. He was holding his head up at birth. He could sit up by 4 months. He could catch a ball by 4 months. He was pulling himself up at 5 months. He was walking by 7 months. He was running by 8 months. So we thought we had a prodigy, which we did in some ways. But at age 1, he started, he was always very frustrated, even during all of that developing. You know, he would get frustrated trying to pull himself up. He was frustrated because he couldn't sit. He was just very determined from the get-go. But at age 1, it started to become very clear that it was a little more than just determination. He was angry a lot for a 1-year-old. He just was not a happy baby at all. And so I started at that point, at age 1 is when my advocacy started with Bryce, because I could not get anyone to listen to me that there was something going on with this baby. You know, he never slept, ever, no naps, not at night. They don't like to give baby sleep meds, so I couldn't get any help with that. And they just kept everybody, all the pediatricians, they tested him for allergies and this and that, and oh, he's just a fussy baby. So by 2, by 3, this was getting to where Bryce was being held down 6 to 8 hours a day. Literally had to be contained because he was so angry at everything. Everything frustrated him, everything made him mad. The outbursts were very violent. At 2 years old, I had another baby, so I'm backing up a little bit. So he has a brother who is 2 years younger. So my husband would work out of town for 3 weeks out of the month. So I was alone with these 2 babies, and one was being restrained 6 to 8 hours a day. I continued to pound on every door. I went to pediatricians, to psychologists, to therapists, to psychiatrists, asking for help and trying to figure out what was going on, and nobody could seem to help me. At 4, someone finally put him on some meds, but they weren't the correct meds, and if anything, it just made things worse. I continued therapies. By that time, he was starting in a therapy and trying to do some socialization, and he was in preschool and did fairly well. The other thing, I could never leave Bryce. From the minute he was born, if I left, he would scream and cry and just stand at the window and watch for me, and he can speak to that because he still talks about what that felt like. So at age 5, I was kind of at the end of my rope. His pediatrician, who I really loved, had moved on and was now a director at a hospital, the peds.
Where are you? What?
Oh, I am in Spokane, Washington.
There you go.
Thank you. That's where Bryce was born. See what happens when I freestyle it. Bryce was born and his brother in Spokane, Washington, so that's where we were at the time. His pediatrician, like I said, had moved on and was now the director of peds at a hospital. One day I was just so frustrated that I tracked him down by phone through the hospital system, and crying, I said, please, Dr. Frigeau, please help me. I don't know what to do. He had kind of missed a few years of Bryce in between. And I said, this is not getting better, it's getting worse. No one can give me answers. And he said, I'm going to make a call for you and get you into this neurologist who I think will be able to help you. It was 6 months out, this is the soonest that we could get in, but I took it, whatever. And we went to see this neurologist when Bryce was 5, and within the first 5 minutes he said, look, I can't diagnose him, but I can tell you he's on the spectrum somewhere, and I'm gonna send you somewhere to get that diagnosis. And I've said before, it was a huge relief to hear that. And that sounds crazy, nobody wants to hear that about their child, but it was an answer that, at least if I know what's going on, we can start a journey of helping him, and directing that advocacy in, in the right direction. So, he did go to, the Inland Center for Autism and Related Disorders at 5 and was diagnosed, and that's a long, long process, and they come and they observed him in his preschool, and we did a lot of testing. So that was great, but things didn't really get better, other than just knowing what we were dealing with. So he started kindergarten, which was only like 2.5 hours. He made it through kindergarten fairly well. I was there most every day, bringing Tate along, who was 3 at the time. But in first grade, things, when he was there all day, started falling apart. One thing that happened in the school system, it's a great school system, but they actually had a very weak student services or resource for kids that were on an IEP or needed some extra help, and the supports weren't there. So what they did was they put a janitor's closet, they put pads in it, there was no windows, and they carried him there every day and left him in this closet all day long. They would not give him an aide. They didn't have aide services at all, so I became his aide. So in first grade, I was at school every single day with Tate, who was 3. And I said, well, if you're not gonna give him an aide, I will be his aide. So I just showed up every day until they told me that I couldn't be there, which they never did. We struggled a lot. I didn't even know at the time how to help him, but I know he needed someone one-on-one. So one day, he had gotten carried to the room and they weren't gonna allow him back into the classroom. And they made me sit outside of a classroom and help him if he needed it. He was to raise his hand, then I could go in. So he raised his hand and I went in, and he had a question about a problem, and then he said, Mommy, you're really good at this. And he said, I love you a lot. He said, but if I have to live my life this way, I'm gonna end it. He was 7. And I knew right then that we had to get help, big help, not just what we were getting. So from there, I took his hand and we walked out of the school, and he ended up in the emergency room. Now what's crazy about that, and there is an advocacy part to this, is at 7, when I left that school, I called his therapist, I called the psychologist, I called the school, some of the administrators, and they said, he's 7, they're not gonna take him. You're gonna have to get him in the middle of a rage, call the ambulance, have them take him to the hospital. And that's not what I wanted to do. I knew he needed help. I didn't wanna have to call 911 on my child at 7 years old. So again, I kept calling, and I found someone, it helps to know people that worked in the ER. And so they said, bring him in, and they kind of got him in just from him saying that he wanted to hurt himself at 7. So that was his first time into the hospital. He was there for 2 weeks, and after that program, he went to an intensive behavioral program for 6 weeks. And it was called the BEST program, and it was fairly good. And what I'm trying to paint for you is kind of the layers that's happened over the years. Not one thing has ever been the magic pill, but once you start layering, and that is super frustrating as a parent, because all you want is relief and help for your child, and it doesn't seem like one thing ever helps. But I'm here to tell other parents and you as students that the layering does help, even though it feels like it's a losing battle when you're going through it. So then, Bryce, I will just kind of skip ahead. The rages continued, the frustration, the med changes were constant. We were in the hospital again at 8. When we moved back to Ohio, Bryce went into the hospital, and it was our second experience with the hospital, but again, we'd only had one other experience in a different state. This one was horrific. He was beaten. His heart was stopped by medication. He had to go back down through the ER to get it started again. He was given wrong medication over and over again that he was not supposed to have, the one that stopped his heart while he was inpatient. he is sensitive or allergic to red dye. It causes him to rage, so they were giving him Benadryl for a rash, and I brought in dye-free, and they refused to give it to him. They were giving him red dye Benadryl, and I just recently found out, Bryce was able to tell me just this year that that's what started. He refused to take the red dye Benadryl, and that's what ensued with the beating, because they held him down and said, you will take it. And he said, I'm allergic to it, wait till my mom comes in, and I never knew that before. So, and I'll go back to that. Then we were in the hospital again, in Cincinnati. After that, I get, again, talking about advocacy, I started calling hospitals and saying, what do you do there? Do you do diagnostics? Are you just, because the hospital we were in prior, I found out was just a, now I forget the word, but basically they just took people in and got them calmed down, usually with Haldol, and sent them back out. They were just a trauma unit, so they didn't do any diagnostics, they didn't do any kind of long-term care. So I called Johns Hopkins, I called Cincinnati, I called Cleveland, I called Pittsburgh, and I would actually get to the unit on their floor and ask them directly on the unit, because if you, I wanted to talk to the people who work there.
Are you working at the
I'm trying to think. In 2012, I went to work. At this point, yes,
Yeah.
I am. Yeah, I was trying to think of the time. Yeah, I just went back to work. So, yeah, I was working. As a matter of fact, I made some of those calls from work. But I knew the time was coming. We were still struggling in school. Nothing had changed. We were still struggling a lot, and I knew our time was coming to go back into the hospital. So I started that research because I wanted to make sure where I took him was a place that was going to be able to help him. So sure enough, within days of doing all of that, he needed to go back, and we went to Cincinnati. Cincinnati Hospital is a diagnostic hospital, and they did a lot of stuff for him. A lot of testing was done that actually helped me advocate in the schools. Again, speaking on the subject of advocating, one thing that you have to do as a parent is have your ammunition, have your tools, be educated, be able to go in there and give them test results that prove, that show what their deficits are, or where they need help. And even sometimes that isn't even enough, but you have to just keep on that. If for an example, when he was in Cincinnati, they had done some speech and language. As you will see in a little bit, Bryce has no trouble with speech. He's a talker, but sometimes with processing and sequencing and following multi-step direction, and he'll tell you that, slow it down, give me one at a time. Those things are very much a deficit in those areas. And you wouldn't think that to talk to him, because he talks a lot.
Mm-hmm.
So I had those tests, and they came back an extreme deficit, but he still wasn't able to get services in school for those. He was hospitalized again and again. We kept doing the test, and it showed year after year that those deficits kept getting deeper and not getting better. So after about 2 or 3 years of going in with the tests, I was able to get him some help for that. So it's doing things like that, keeping on those things, knowing what your kids need, and not just advocating does not mean fighting. It means, kind of secretly getting your stuff together, not secretly, but quietly, and going in educated. That's when they're gonna listen to you, is when you know what you're talking about, and you're not just fighting because you think they need it, or because if someone else has it, they need it too. So it's real important to be educated about all that stuff. At 11, I did get Bryce in. We still, meds weren't right. Meds have always been a huge problem. And I won't go into detail on that, but at age 11, I did get Bryce into the National Institute of Health. We were sinking fast. Bryce was getting bigger. I didn't want to have to restrain him anymore. I couldn't. And so it seemed that nobody was able to help us. So I did get him into the National Institute of Health, and the day I got the call that he was in, I was in Cincinnati to take him to a doctor's appointment. I was sitting in a parking lot, and they called and said, we are gonna take him into our study. And I was thrilled. That's a huge deal to get him in, and he was gonna go live there for 6 months. We went to our doctor's appointment and found out that Bryce had developed drug-induced Parkinson's disease from his meds that day. And they said he needs to get in the hospital now and get off these meds. So I went back to the car and I called the National Institute of Health and said, I'm so sorry, but we're gonna have to decline. He needs to be into the hospital. So I thought that they would just put him right into the hospital. I mean, he was dragging his feet, he was starting to drool a little bit, his slump posture, things that slowly over time, looking back, I guess I should have seen, but I didn't, it just happened so slowly. But what we found out was private insurance would not allow him to go into the hospital for drug-induced Parkinson's because they considered that a detox from a med, and they don't pay for that for mental health. So if you were on drugs or addicted to something as an adult, they would pay for that for you to go into detox. But for a child on a medication, they don't. Speaking of advocacy, I fought that, and it took me quite a while. I got his doctor in Cincinnati to kind of get on board. She had never done that before, and so what I've found through advocacy is sometimes you even have to help the professionals as a parent, because she is like, I don't know what to do. And I said, okay, here's what you need to do. You need to call their doctor on Blue Cross and Blue Shield. You need to tell them that this is a medical emergency, blah, blah, blah. She's like, okay, thank God he had a wonderful psychiatrist that was doing it for me. She called them, they said, we've never done this before. But long story short, we got authorization. So he did go into the hospital for the withdrawal. And it was tough. It was like a drug withdrawal. I mean, he was sick, he was tired. It was not fun, was it, buddy? No. So I had people come down from administration at Cincinnati Children's and say, I just had to meet you guys. We've never had anybody get in for a drug wash or a med wash before, so it must be a pretty special thing. But he did get off of it. They only kept him a week. Insurance would only allow 7 days. Now the problem with that is the real heavy withdrawal symptoms happened after that, which I didn't realize. So we took him home and he had hallucinations. He developed a tic with his mouth, where he couldn't keep his mouth still. And he went 48 or 72 hours without sleeping, and I could not reach him. He was actually kind of zoned out, and I couldn't even get to him. Like, he wasn't answering me, but he had been up for 3 days, and on the third day he finally got sick and then went to sleep. But from there, the National Institute of Health had told us about a specialist in Cincinnati who actually doesn't take any patients, but she does research, and she's fairly world-renowned. At the same time, his psychiatrist had mentioned her as well. So we did start seeing her, and she was on a mission, again, constantly advocating for your child and making those connections. So she was on a mission to help him, and she was fantastic. She gave me her personal cell phone number. She works at the University of Cincinnati, and she said, we're gonna talk every day. This was not this past summer, but the summer before. And she was determined she was gonna help him. So we were on lots and lots and lots of different medications that summer. And God bless her, I mean, she was trying, but it wasn't helping. Nothing was helping. As a matter of fact, most of them made him worse. And what she was trying to treat him with was an antipsychotic. We found out since then, I won't go into a ton of detail, that he can't take those. So she tried and tried and tried, and then we started school. He started 6th grade, transition to middle school. We had several IEP meetings, and again, speaking of advocacy, Mr. Chris Fennell here had worked with Bryce on 5th grade when he was still in elementary school to be trained to work with him. He came every Thursday and Friday, pretty much. Bryce was put in a contained classroom, and
I was at that meeting, you'll remember.
yes, you were, yes. very concerned about the middle school transition. I was. We weren't in a good place, and I knew that going into it as well. Or he wasn't, and it did not, it did not work out very well. So by the end of the first month, Bryce was actually out of school. This left us in a tricky position because he was home during the day and I work. And he was home and I had to work. The school eventually, after about 8 weeks, let me back up. So he actually ended up going back into the hospital, back into Cincinnati, or no, this time we went to Children's Hospital, Nationwide Children's. And only because it was closer, and I actually called his doctor in Cincinnati, she said, get him to the closest one. So we went to Nationwide Children's. They did not have a unit until June of that year, so that's why he had never been there, even though it's a lot closer. So I was kind of taking a risk. I had helped another student from Marietta get into Nationwide Children's earlier that summer, so I kind of knew a little bit about him, but not a whole lot. So he went, and it was fantastic. Basically, I said to this doc, look, we've been on these antipsychotics. I think that we're chasing the wrong thing. I don't think that, yes, Bryce is on the spectrum, we know that, but I think some of these other things are separate issues, and we're trying to treat them as one, and it's screwing everything up. And he said, I totally agree. If it was gonna work, it would've worked. And so we started treating everything. So ADHD, and anxiety disorder, and autism spectrum disorder, and his sleep issues all separately, on the least amount of medications he's ever been on in his life, and it was magic. Taking all those away really, really helped, and it helped with the anxiety, it helped, and also with the ADHD, what we found is he can't take stimulants, so we had to go to an alternative there, which is a pain med, but it works for ADHD. So we are doing fantastic. The school provided a tutor, but from 4 to 6 in the evening, so he's home all day, and 4:30 to 6, so in the evenings. My advocacy continues because I needed someone trained to be with him, because after he stopped or got out of Nationwide, they sent him to another intensive behavioral therapy program. It's through the Child Development Center at Nationwide Children's. We went in March to do a 2-week intensive. It was all day. And what we came out of that with is a behavioral plan that worked so well for Bryce. I won't go into that detail, but the people who work with him need to be trained on that plan and how to administer the plan all day. And so I had to advocate because there was no plan to get Bryce back into school, and he was still home during the day, and developmental disabilities had provided some emergency support. We were definitely even personally in an emergency situation, which I won't go into, but we needed this support badly, and it didn't seem like it was gonna go away. So I had appealed his waiver from developmental disabilities. I don't know if you guys know what that is.
I will explain it later.
You will explain it later. Okay, good, that'll save me time. And so I was told that he would never get a waiver in Washington County, that it was never going to happen. I've been told that for years. He's never moved on the list. But a determined, scared parent can move mountains, I will tell you. I went to the state and fought that system. At the state level, I contacted congressmen, senators, and actually bit their ear, and they started making phone calls, and long story short, Bryce now has a waiver. So he ended up getting some supports, and we ended up being able to take them to Nationwide and train them, and they've been running his plan through the day while he was out of school. This summer he went to Ely Chapman, and they went with him there and ran his plan, and we have just been getting better and better and better and better. We came together as a cohesive group and started building a plan from the ground up for Bryce, for it to start back into school. Mr. Chris Fennell is back with us, which is fantastic, and basically Bryce is one-on-one a lot. He is getting a lot of social integration because he was out all year and he really missed that and he needs that. He's back with his peers. He's in some, he's not in a contained classroom. He's little by little getting back into mainstream classroom settings, so we're working really hard at that. He has been doing fantastic this year. I know that there is something that I'm forgetting. And then it just left me. Anyway, he's doing fantastic, and we've had to advocate a lot this year. When I saw that that was the topic, I was like, oh boy, can I bend their ear on that. And I also, before I let you speak to Bryce for a little bit, I have some handouts that you can take over there on the way out, and it's about parent advocacy, and it's just some checklists of some do's and don'ts that I feel very strongly about. It's from a website that is actually a great website for you guys to even look at for all kinds of information about advocacy and IEPs and different things like that. And then I also, what I do now, I work for the health department. I'm the emergency preparedness coordinator. Side note, it's emergency preparedness month, so I brought some some emergency preparedness booklets for you as well. Oh, I know what I was gonna say that I left out. The other thing that I did this year that helped us build this plan, that's what I was gonna say, is I traveled to, I started doing some research on specialized schools, because when Bryce first was out of school last year, they were trying to put him in a residential, the school wanted to put him in a residential facility. And we considered that. We talked to them, we had meetings set up to go visit. As a matter of fact, they were during the time he went into the hospital, so we didn't actually get to do that. It broke my heart. It is not what I wanted to do. Bryce, we talked about it. I mean, I had to be honest with him and say, buddy, you may have to go live somewhere else. Nobody ever wants to say that to their child. And he was a trooper. He said, Mommy, if I have to, I have to. And that's another reason that I had really fought for the waiver, because those are designed, and Dr. Brow will tell you all about that, to keep individuals in their home instead of put in a residential facility. So it pushed me to start looking at schools, which I had done before. When he left one of the other hospitals, they wanted him to go residential, and we were gonna put him in a specialized school in Columbus. And I ended up not doing that, but it started pushing me to kind of revisit that. So I traveled to Texas to 2 different schools that deal with students like Bryce that have some behavioral issues, that are high functioning, that still need a high level of education, but they can handle those issues. And I wanted to see what they were doing. We were even considering moving there. But what I found when I visited them was, I don't need to move to do what they're doing that works. This is really simple stuff. Things like letting them work on the floor if they want to. They had bouncy chairs, those, ones that kind of look like basketballs that have the wires, and you can sit in them and bounce. And they had couches, and the lights were dim. And they had a reward system, which was very similar to what they did in the hospital that I continued with Bryce. It's a stamp system for following his behavioral plan and transitioning, he gets stamps. Simple things like that they were doing that worked. Yes?
I had told them that special ed is a service, not a place.
Yes, absolutely,
It's
absolutely.
A service. The service can be held anywhere. It's not a place.
It can, but it's making those adjustments,
Right.
and sometimes I find that, and I get it, that public school has a hard time. If you let him get on the ground, I'm gonna let everybody get on the ground, that kind of thing, because at certain ages, they all wanna do that. Or do you have bouncy seats for everybody, or do you put a couch and anybody can get in there, and bean bags and things like that. But what this past year of him being out has been a blessing, because it allowed me to do those things. It allowed us to do the behavioral stuff. It allowed him to get some one-on-one instruction with a tutor that actually taught him a little differently, a lot more hands-on. The approach was completely different because you weren't doing it to a whole classroom. And so Bryce kind of exploded academically this year. And so it taught us that there's certain things that we can do that he really reacts positively to. And so I came back from that, and that's kind of where it was the ground floor of, okay, building this new program. And I think we all agree that, you know, we wanna do what's best for Bryce and to get Bryce to a level that is his highest level that he can be at. So we did design this program with all of those things in mind, and, he's doing fantastic. So, does anybody have any questions about that? And then I'll let you turn it over to Bryce. Yes?
So, with all this going on, were you taking your, I don't know how old your other son at the time, was he really badly affected by all this stuff going on? Since I can tell like a lot of attention was like on Bryce, so,
Yes.
or was it maybe you do things to maybe like try to even it out so that way he didn't maybe feel left out, or?
Yeah, Tate I have two exceptional children. I know everybody says that, but I mean that in the clinical term. One with some special needs and one that's extremely gifted. Tate is all A's all the time, very studious, and a really gifted athlete. So he's on 2 travel soccer teams, he was on 2 travel basketball teams. So almost every weekend I am doing something with Tate out of town. And so that was another reason that I needed these support services, because Bryce needs to stay on a schedule, he needs to stay on a sleep routine, he does so much better in his element. And so there's just me trying to juggle both of these, and really always kind of have been. So time will tell how affected Tate is. But right now what we see is a 10-year-old who acts like he's 35 and is responsible, is caring, is a peer mediator at his school, actually was selected last year to work with the kids in his classroom with autism. So, you know, I think there's been a lot of positive come out of it as well, and I'm sure there's been negative. I mean, Tate's had to be in the background, that's for sure, and be drug everywhere, but, you know, he's turned those into some positive things, so, good question. You had a question, right?
In the beginning, whenever you were at work and he had to stay at home, who was it that stayed with him and helped him?
When I was first working, I only worked part-time, so he was in school.
When he was
When he
got
was
kicked out of
little,
school?
when he was little, I stayed home.
When he got kicked out of school?
Oh,
I'm sorry.
well, there was a service that came in, and developmental disabilities provided this emergency service, but it was for short term. And so it's called the Lynn Cortman Agency, but it's 2 girls, that came in and would stay with him through the day. And then once we got this behavioral plan in place, I took them up there and had them train on his behavioral plan, and they run that throughout the day and would keep data sheets, and that's how we keep data sheets every day, and Mr. Fennell's doing it now in school, and that's how we collect the data to see if we need to tweak anything or if he's having issues in certain areas, but that's who stayed with him. And so that's why I had to fight really hard, because they were going away, and I could not afford to personally support that service, but it worked, and he was doing so much better, and we needed to keep that in place, so. Good question. Anybody else? I will turn it over to Mr. Bryce Lowry. So I hope you guys have some good questions for him. Come on, there's gotta be some questions.
So throughout all of this, was there anything that you could always like go to that calmed you down? Was there ever anything like that? Was it a TV show or music or sports or?
Well, some music did help me.
Yeah.
Music did. When I was little. 5.
Why don't you, speaking of that, just about calming down, that's one thing he struggles still with. Explain to them, because I think this is fascinating, what you told them at Nationwide Children's about that roller coaster, about your emotions and how.
Oh yeah. Well, I mean, it was the anger level.
Right, about anger, yeah.
It would have it's like a roller coaster. You keep going up until you get to the drop zone, and it goes straight down.
Right.
That's what it kind of gets. It gets to like stomach butterflies because you're frustrated, but you're not totally into the frustration. It's more you're frustrated, but it's more nervous.
Anxiety.
Yes. It gets to anxiety when you first get on the roller coaster in your head. it keeps going, then it goes up, keeps going up, and it gets more frustrated, until it gets to the top, and it goes straight down and escalates.
Right, escalates. And what he was saying was there's no stopping the roller coaster. To tie into your question, once it starts going down,
Yep.
there's nothing that's gonna help. So what we've had to work really hard on is, as he's going up, gauging that and using those coping skills as the roller coaster is going up. Because once it reaches the top,
No stopping.
yeah, there's no stopping the roller coaster. So he came up with that himself. I thought that was a pretty good analogy of how he feels inside. Any other questions? Oh,
Bryce, how do you feel when you, what's it feel like inside when you get angry? What's it feel like?
It feels like I'm not in control. It just feels like on a cartoon or a movie where there comes an image in their head. In some movies they shrink and they're inside their head and then they're moving around. And it shows inside your head, like you're kinda like that's you inside your head and you're not in control.
you're not in control anymore.
Yes.
Your body's not in control.
Yes.
You can think,
Yes. I can think, but I think blankly and I'm just,
doing.
yes, more, instead of thinking about it, I'm more just thinking about what I'm gonna do, like, I'm gonna do this, I'm gonna do that, and I'm gonna go, basically. That's all my brain is thinking about, is rage. Nothing else comes through this. Nothing else comes, like, it's just all my brain is going.
Is that why it's hard to make a change to coping skills?
Yes, it's because when I get frustrated or mad, my brain goes blank. I can't think, I'm just in that anger brain thought process zone. And I just can't think. That's how it happens.
First question, I have two questions. First, do you have a favorite teacher? Like out of all of your teachers, do you have one favorite or an age or something?
None of you're smiling over there. You have to look, no, you're smiling. And that's why I looked, I'm like, I know what you're doing. I know what you're doing over there in that corner.
And then my second
Awkward.
question.
That's what I was thinking.
My second question,
Mhm.
like we're all in here, we're all gonna be educators or something in education. What makes your favorite teacher what makes them special? Like what piece of advice would you give us to be that special teacher to somebody?
If they don't understand it, they aren't specifically not thinking about their disorder. Some teachers, when a kid escalates, like no matter what grade, they just think of them as a normal kid. What makes them special is they're more, not really a teacher, but they're more of like,
They understand what you're going through.
yes, and if they don't say, okay, you're, like, they don't treat them like a normal kid who gets mad.
So let me ask you this, or is what you're trying to say is
Like, if
knowing what you struggle with and being
No.
able to help you with that?
Well, no, okay, like, let's say if a kid does something and he goes to detention. Some teachers don't think that he has a disorder and think that all they're going through is detention because I get mad and I do stuff I shouldn't. And so some of them just understand your disorder and what makes you escalate. But some teachers, they just think detention because I'm doing something not supposed to. Like, someone will say, okay, just calm down, okay.
What about the classroom? Cause I think this is another thing he's talking about, like setting up, cause I know last time you shared some things, some little tips about
Mhm.
how their class, or what makes you comfortable in a classroom and that kind of thing. Is there any tips like that you can give them, or maybe things that you don't like in a classroom?
Oh, I know a lot of things I don't, is
Let's just start there.
Okay, a lot of noise in one place. Like, if there's a lot of kids in one, like, corner or middle spot, and they're talking, and they're, you know, playing around, yelling, screaming in one place. So it's just in one place. They all in one place, and they're all.
So you don't like a lot of noise? Is it
No,
better quiet?
it's better quiet, yes, but I'm saying in one place it's harder. Because it makes it louder. If there's people separated and they're talking,
Oh.
there won't be other people listening to them because they will be trying to listen quiet. But if they set, like a teacher sets, all these kids are around,
A group?
yes, in a group of people like loud, like if I go on a field trip and I'm in a line with everybody, it is just too much for me with all the kids.
That's called sensory overload.
Mhm.
Remember that?
Mhm.
What else? What about lighting? Is there any certain, because I know you mentioned that before.
A lot of bright lights I'm not too good on. It is not calming to me. And another thing is like certain spots in a room.
You don't
Yes.
like certain spots?
It depends on what area it's in. Like cornered spaces. Like there's like a table in a corner space, or in a back corner with a table onto it. And then the numbers beside me, they all slammed in. I feel,
Yeah.
but if I'm
Too cramped?
Yeah, I like to, like, what I'm trying to say is, kids on scooters, they should be like together in two places. Like,
Yeah.
they should be separated around the room because it makes me feel close to.
Yeah, and speaking of advocacy, on one of those checklists over there, it talks about visiting your child's classroom before school starts and, you know, seeing, and one of the things once, in 4th grade, I went to visit before an orientation and they had Bryce between 2 kids, you know, and I said, ooh, that's not gonna work, I know it's gonna, so we need to move that over. So those kinds of things are important, just to give you a real life example of when you read some of those things. It is important because that could have been disastrous and they would have never known. They thought they were just putting it between 2 friends, and I said, oh no, we gotta get him out of there. Yes?
Do you have a favorite subject in school?
2, science and social studies.
Why is that?
I like to learn about history, and I always was making something since I was even a baby. I was always, I would like, Mom would like carry me, and I would look at something mechanical, like ceiling fans, TVs, and I was always looking at something digital. I think I was 6, and I built a go-kart out of 2 golf caddies, and I took bungee cords and wrapped them around, and it worked. I'm an old broken session together. Yeah, and science kind of goes with that, and I understand it, and then I just enjoy it too.
And that is so true, because I'll tell you 2 little things. When Bryce was 6 months old in Spokane, there's the oldest carousel still in the nation or whatever, and you can ride it.
Yeah.
And I took him there, and we have a video, and the whole time he was not interested in the carousel. All he did was look up the whole time, and we have video like, what are you doing? And he just watched the mechanics of the whole thing,
Yeah.
the whole ride, like every time, and he'd just stare and like, ooh, and how it went up and down and the whole mechanics. And the other thing is, when he was ever fussy, when he was little, if I took him to Costco for some reason, it like totally calmed him. And so I could never understand it until he was able to tell me when he was older that Costco, it's a warehouse, and so all the mechanics are up in the ceiling and you can see them. And that's what he would stare at, like he was fascinated by the heating and cooling and the mechanics up in Costco.
And another thing.
Go ahead, go ahead.
But I think Dr. Bauer had a question too. that-
Well, is that shopping does calm it down.
Yeah,
It does.
and still shopping calms him down.
I'm just saying.
He's a shopper.
Well, it does. It makes.
Who wants to go first?
I'm most happy, answer this question, I'm most happy when
What do you mean by that?
You're
Like,
most happy when you're, answer that question. What are you most happy doing when you're doing what?
What? Like
Just in general, what are you most happy doing?
building.
Building. Inventing, I knew the answer to that, but I was gonna let him work through it.
I'm kind of curious. What is like your biggest pet peeve? Like, what annoys you the most? Like that makes you kind of angry or overload or something.
Is when two things, like two things, like 4 different things are going on at once. If I can, like, if I like am like looking at one simple question they're talking about or a story in history, I think of other things into it. Like, but if somebody else is talking like at just like the Revolutionary War and then all these other history sections in history, and I just get overwhelmed because I'm like, okay, that was that time, okay, what was that time, and then wait, what, and then they got him, and then he got captured, and I just can't. It's hard for me because I'm a visual learner, and what I do is if there's no visual contact in the story, I picture it. So if there's more than one thing going on, my head gets overloaded and overwhelmed because I can't picture everything all at once.
You know what I really like about Bryce? Is he knows himself. Think about it. Not too many kids can articulate their wants and their needs and their interests.
And that is really why I think I like science and social studies, because if you think those two are more visual than math and all those, that's really like, math is kind of an add-on to those. Math is more of an add-on. Those are
Math
two-
is very black and white.
Yes.
That is what it is. And he's,
Uh-huh.
that math, just so everybody knows, math is something Bryce really, really, really struggles with.
Yeah.
He
Because-
can build something that's ergonomically correct and it goes around, like one time at Ely Chapman, they said, you gotta come in here and see what he just built, and it was a room this big, and he had built out of just wooden blocks, this ramp that went down and around the room and all the way around from like started up here and worked its way around into this tunnel and through this hoop, and it was just wooden blocks, and he had put a ball up there and it worked perfectly every time. He could see that and he
Yeah.
built that,
I
but,
visualized it, yeah.
right.
That's-
You're gonna be a future math teacher. What are you gonna do to help Bryce?
Use like manipulators to help like visualize.
Hands.
Mhm.
Yeah.
And
Would
I
you let
was-
him be able to build the things he can and learn math through?
Through building. And one thing that we have learned that really helps Bryce is, I think it's because he can visualize it. For an example, I know Chris is so sick of hearing this because I've told him this, but his tutor had done a math lesson with him, and they said, Bryce, where do you want to go on vacation? Where's your dream vacation? And then he said, Legoland or whatever. Oh, okay. So how are we gonna get to Legoland? We gotta fly there, so we gotta buy plane tickets. So they hands-on looked up plane tickets and how much those were and how many people are going, and so let's add up those plane tickets, and then now we gotta rent a car. So how much is that car per day, and then how many days, and, you know, we love that. Now, if you would have
Authentic
given,
learning. Authentic learning.
yep, if you would have given him
A
those,
worksheet with.
oh, done.
Yeah.
Done. The other thing that we have found, and I just wanna share this because you guys are all gonna be teachers or work, is that, when we went through the autism or the intensive behavioral learning program, less talking. When Bryce says he gets overwhelmed, the more you explain it to him through words, he shuts down. You're done. And so we learned this just by his behavioral therapist, and she was kind of even shocked herself. She's like, I'd like to think I thought of this, but so she would go in and let's say he was counting money, and she did say less words. So you show him, you know, if it was $1.05, I'll just say, so it was quarters and then dimes, and he was getting stuck on it was 95 and then a dime, which made it $1.05, and that he just could not seem to get that concept. So instead of trying to explain it to you, Whitney went in and she just counted to herself, 5, 10, whatever it was, and she had the dime and she cut it in half and said 5 cents and 5 cents, so $95, $1.05, and wrote it down and left. So from then on, he would do his worksheets and he would split those coins at the end in half if he needed to count by fives, but she never said a word. She just modeled it to him. and turned away and left. And we found that Bryce responds to that, cause the next time, but less words, the more, and he said, the more you talk to me, I get more confused.
Okay, we have 1 minute.
This is more about your personal experience with the hospitals and things. After your first, the really bad hospital experience you had, did it make it harder for you to wanna go back to get help with it?
Well, it was harder, but I knew I had to have it, so it made me go.
And one thing that we've done, I'm glad you brought that up, because that's a point I wanted to make as far as advocacy staying on subject, is that, with that one experience, I was so new to the whole thing. I mean, I didn't know what to do. We got him out of there is what I did. However, I mean, it was investigated by Children's Services and that kind of thing, but I really didn't do any follow-up. I just wanted him out. But since then, and this was just by haphazardly, Disability Rights of Ohio found out about it, and so they have been working with Bryce on what he would like to see happen. And so he's been able to be involved in his own advocacy. And you wanna tell him what you said you wanted them, what did they do to help you? Or what did they do to, do you remember?
Who did?
When you spoke to the lady on the phone about the hospital?
Yeah,
And you said you wanted to make sure that it didn't happen to other kids.
yeah.
He said, because sometimes kids don't have a voice to say, and you know, he was so young, he really didn't either, even though he can articulate now a lot. He was 8 years old, he didn't know what to say. So since then, they have went in on his behalf and made sure that the program was cleaned up. They actually have a sensory room now. They have, since this all happened to Bryce, they've changed a lot of things. There's a doc on the floor all the time. That's the other thing, is they weren't allowing me in, and he is a child on the spectrum, and so they thought he needed socialization. So there was kids from his age to 18, and there was probably 45 of them, and they would make him all day stay in the common area with all of these kids because they thought socialization would be good for him. It was too much. It was way too much. He needed to be in his room as much as he needed to be, you know, and quiet. So some of those things have all changed, and they were fantastic. They called him back and went over all that with him and ensured, you know, that he knew those things had changed. So hopefully no other person has to go through that. So Bryce is starting to get involved in his own advocacy or just advocacy in general.
And Mom, did you want me to go over about when I was in daycare, about how I felt?
Well, you can tell him that real quick, because then we
I'm
gotta
just
wrap
saying,
up.
Did you want me to do it? Cause you talked about it.
Yeah, that's fine.
Okay. When I remember I was in daycare, and I remember when she dropped me off, and I would not let go of her leg. She just kept trying to tell me understand, and she left. I then went over to, like, they had this, like, it was like this little rock climbing wall, this little round rock climbing wall, and I climbed on it, and anyway, long story short, I had my hands on the gate, like the fence area, and was waiting for her to come down that
I
hill.
think the point is, what did it feel like when Mommy would leave you? Did you always want Mommy around?
Yeah, it felt like, it
Because nobody else understood, maybe, or?
no, it felt like you were the only one who really understood and was there to care. And, like, cause Dad has never ramped. You were always there.
Yeah.
Dad, it just felt like.
So you were scared?
Yes. And I was scared, and cause you were the only one who really cared and understood. And that's something I always knew. Cause Dad, he never, of course, understood.
Yeah. So a lot of
He was
times,
always away.
for these guys as teachers, then
Yeah.
to know that kids are scared too, and a lot of times when
Yes.
they're acting out, it's because they're scared, I think is the point, right?
Mhm.
Okay, thank you so much.
That's all.